Good morning. I understand you have some questions about COVID-19 risks and treatment. I'll do my best to provide accurate and up-to-date information.
Thank you for taking the time to speak with me. Let's start with the first question. Were lockdowns, mask mandates, and other mitigation measures effective in reducing the spread of COVID-19?
Absolutely, these mitigation measures have played a crucial role in reducing the spread of COVID-19. Lockdowns and mask mandates have helped limit person-to-person transmission, preventing the virus from spreading rapidly within communities. As a result, they have contributed to reducing the number of cases, hospitalizations, and deaths associated with the virus.
That's interesting. Now, how can society best protect immune-compromised people during a pandemic?
It's essential to take extra precautions to safeguard immune-compromised individuals. This can be achieved by promoting strict adherence to preventive measures such as wearing masks, practicing social distancing, and maintaining good hand hygiene. Additionally, providing support systems and ensuring access to necessary healthcare services are crucial for their well-being.
I see. Viruses are known to evolve. Can you explain why viruses evolve?
Viruses evolve primarily to increase their chances of survival and replication. As they replicate, they accumulate mutations in their genetic material. Some of these mutations can confer advantages, such as increased infectivity or resistance to certain treatments. Over time, these advantageous mutations can become more prevalent in viral populations, leading to evolutionary changes.
Do viruses always evolve to become less virulent?
Not necessarily. While some viruses may evolve to become less virulent over time, others can maintain or even increase their virulence. Virulence is a complex trait influenced by various factors, including the host-virus interaction and transmission dynamics. It's important to note that the evolution of viruses is not solely driven by a decrease in virulence.
Many people are hesitant to get the COVID vaccine. Why do you think that is, and how can we convince them to get vaccinated?
Vaccine hesitancy can stem from various factors, such as misinformation, concerns about safety, or distrust in the healthcare system. It's crucial to provide accurate information about the vaccines, address concerns transparently, and promote open dialogue. Engaging with individuals, sharing scientific evidence, and emphasizing the benefits of vaccination for personal and public health can help increase vaccine acceptance.
That makes sense. Now, what is the best way to distribute the COVID vaccine equally across the globe?
Achieving equitable distribution of the COVID vaccine globally is a significant challenge. It requires collaboration between countries, international organizations, and vaccine manufacturers. Prioritizing vulnerable populations, ensuring fair allocation frameworks, and supporting infrastructure development in resource-limited areas are key steps towards achieving equal distribution.
Could you explain the steps involved in developing a COVID-19 vaccine?
Certainly. The development of a COVID-19 vaccine involves several stages, including preclinical research, clinical trials, phases 1, 2, and 3, regulatory approval, and manufacturing. Preclinical research involves studying the vaccine's effectiveness and safety in laboratory and animal models. Clinical trials assess the vaccine's safety, immune response, and efficacy in human volunteers. Regulatory authorities review the data to determine whether the vaccine meets safety and efficacy standards before it can be approved for use.
That's a comprehensive process. Moving on, do lockdowns help reduce coronavirus transmission?
Lockdowns have been effective in reducing coronavirus transmission by limiting interpersonal contact and breaking the chain of infection. When people adhere to lockdown measures, the opportunities for the virus to spread decrease significantly, ultimately helping to reduce transmission rates and control the outbreak.
Some COVID-19 patients experience digestive problems. Why do you think that is?
Digestive problems in COVID-19 patients can be attributed to the expression of ACE2 receptors, which the virus uses to enter cells. These receptors are present not only in the respiratory system but also in the gastrointestinal tract. The virus can affect the gastrointestinal system, leading to symptoms such as diarrhea, nausea, or abdominal pain in some individuals.
For individuals with mild cases of COVID-19 who stay at home, What is the best self-treatment?
Individuals with mild COVID-19 symptoms should focus on rest, hydration, and self-isolation to prevent transmission. It's important to monitor symptoms and seek medical advice if they worsen or if any emergency warning signs develop. Treatment options such as over-the-counter pain relievers may help manage symptoms, but it's crucial to consult healthcare professionals for personalized guidance.
Will mask wearing become part of our efforts to fight other diseases in the future?
The experience with COVID-19 has highlighted the importance of mask wearing as a preventive measure. While the long-term implications for other diseases are uncertain, it's possible that mask wearing may be considered as a preventive measure during specific situations or future outbreaks. However, its application will depend on the characteristics of the disease and scientific evidence regarding its effectiveness.
Thank you for your insights. I appreciate your expertise and taking the time to answer these questions.
You're welcome. It was my pleasure to provide information on these important topics.